A federal judge has ruled that Stockton, California may enter into bankruptcy proceedings. That opens the way for Stockton to become America's largest bankrupt city.
Again, like the student said, this is part of the Public Health Advocacy Curriculum. I think the program is perfect for where we're at right now in Stockton. Just looking at how a failing economic system in our city can lead to the high crime violence and how the crime is actually preventing them from walking around their neighborhoods to getting healthy or getting access to physical activity or even just healthy foods. And so I think that's just a teachable moment to say, you know, look at your city, look at these things that are contributing to your health physically, mentally, and emotionally.
What we normally think of as health is just hospitals, nurses, doctors. Public health is so much more than that. It encompasses the parks, it encompasses the food health in the community.
It also includes issues of race, ethnicity, social integration. If you live in a big house up on the hills, it's hard to know your neighbors, it's hard to have a support system, and that poses many issues for mental health.
We developed the Public Health Advocacy Curriculum in response to the need for more health materials that examine the conditions in communities that were affecting health and not just individual behavior choices, and also materials that were really directed by the students, that were relevant to their lives and that were guided by what was most important to students. The first unit is hands-on activities to teach students what public health is. The second unit allows the students to explore their community and have them identify what factors are promoting health or hindering health in their community. And the final unit is an advocacy project in which the students actually have a chance to act upon what they found in the community.
It really is a broad spectrum of looking at their own world and their own lives and how their community can be affected and how they can affect their community. So it's really about teaching them to be advocates, about empowering them within their own communities, about helping them understand what services and resources are available to them, for their families, and also as they become adults.
One important aspect of our curriculum is engaging students in projects in their communities. We have the students conduct asset mapping and photo voice where they're actually out in their community looking at what strengths and weaknesses exist in their community that they would like to address.
They went off in teams and they actually look at the parks that are here, here's a community center. But they also were looking at the billboards and the advertisements for tobacco and alcohol. It opened up their eyes to things they see every day, but they began to see that as a public health issue.
This liquor store over here is one of about, eight that are on the street. You have access to liquor, you have access to cheap, unhealthy food for your family, all that kind of stuff. I think it brings people down to that level and then it keeps them there because not only is it easy, but it's everywhere.
I remember taking a bunch of students from my school, from my classes, and going to my own community where I live with no adult supervision, with no guidelines. We just explored the community and we're supposed to use that to incorporate into a project about certain diseases and how things in the community can affect these diseases.
Maybe because they don't have access to fresh fruits and vegetables that they're more inclined to go with something cheap and easy. So they started to make the connections on why we have such an epidemic of these health problems in America.
If it was like less fast food restaurants, I think that it'd be, and more healthy, like food markets and like Trader Joe's. I think it'd be better for the community and environment.
Everybody can't go to the gym and work out. But like a membership, you gotta think about how much a membership costs. And then you gotta think about time. And then you gotta think about access, being able to get to that gym.
But one thing we see is that people are talking to each other in their yards. And that's one of the assets of living in an area in close quarters is people get to know each other more and there's more social support.
But our goal before going to do the asset mapping and photo voice activity is really to teach students what public health is, specifically what the upstream causes or root causes of health are. So what are the influences beyond a personal decision?
You'll understand how individual health behaviors and health or disease outcomes are embedded with a broad context. So that's going to be a little bit deeper thoughts, and hopefully you walk out here today having a clear understanding of the next curriculum that we are starting.
The students have the power to do something. Oftentimes students are dismissed as not being able to make a change, and our goal in the curriculum is to really show them that yes, they can.
So it's better to start getting us into this kind of mindset younger, like we are now, so we can actually make the change if it's necessary.
I feel like if you're trying to make a difference in the community, it has to start within the community. You can't bring someone from the outside and try to fix the community because they don't know the ins and outs of that community. They don't know how that community works or how that community thinks. Therefore, the people that live there and call that place home must take some type of action. When people need to come together and be like, let's change this, because if we don't change it, it's not gonna get changed. Being a part of that program kind of opened my eyes to the things that can be changed, things that go unnoticed that needs to be fixed. So, I took it upon myself to talk to my mom about it, talk to my family, my little brother, my niece, my nephew. And I feel like the first thing that must be done is to bring people together. People know that we're all in this together, we must get out of this together.
The advocacy project is really driven by what is meaningful to the students. So we really stress the importance of having the students identify issues on their school campus or in their community, and then actually give the students that opportunity to go out and address what is working well and can be enhanced and leveraged, or unhealthy or harming the health of the community that they would like to fix.
And so I don't know exactly what they're growing in here. It looks like a lot of, I don't know, I want to say tomatoes, maybe tomatoes. Yeah, community food service project. I actually had a little vision of buying some land, and that way they can get healthy food from the food that I provide. And maybe I can employ some of the people from the communities.
I thought that health was so tied to income that if you didn't have a higher income, it was almost impossible to have good health. And going through this program, I learned that it is totally possible, and that's something we should encourage.
Prevention's always the best medicine. If you could prevent things from happening, then you don't have to treat them. If we can prevent our community members from being diagnosed with type 2 diabetes, then we wouldn't have this outbreak of obesity in children and in adults. I think it definitely could be used in any kind of classroom environment.
A lot of emphasis, especially in typical health education classes, is on the individual, and the fault goes to one single person, and it's their responsibility to make a good health choice. But really, there's so much more that goes into it. It's so much more complex, and we're trying to break that down for the students to help them understand how everything around them is affecting their health.